I'm thinking of becoming an egg donor, but you hear lots of different things about it affecting your fertility. Is this the case?
Broadly speaking, no. A majority of egg donors will go through cycles and have no problems with their future fertility at all. The thing I think people often worry about is that somehow they're going to use up their eggs quicker than normal, and people often worry that they might reach the menopause earlier, for example.
Does that happen then, reaching the menopause earlier?
No, because what happens is at the beginning of every natural menstrual cycle, you'll get a whole group of eggs which will start to mature, and then usually most of them will die and just one or occasionally two will go on to ovulate. Now what we're trying to do when you donate eggs is capture all of those ones which start to grow at the beginning of a cycle and get them all to come up to maturity. So the eggs we're collecting would otherwise have been lost anyway, so you're not using up your eggs any quicker.
So is it advisable to have had a family before you do it? Or?
Not necessarily. No, we can tell by doing things like scans and blood tests what your fertility levels are likely to be like. And as I say, generally you wouldn't expect to have any fertility problems following donation.
So you know when you're actually going through stimulation drugs, does that make you more fertile then if you're coming off, if you have the coil taken out, does that make you more fertile being through the stimulation drugs? Because in effect you're producing more and more.
Yes, it can do. So what we ask is that once you stop your regular contraception, normally you'd go onto the pill briefly, but if you're not on the pill, then we ask that you use barrier contraception through the treatment cycle and up until the bleed that you have after the treatment cycle, because you're at slightly high risk of becoming pregnant even after your eggs have been collected, because we never know whether there's one or two just left there inside.
I'm already on the contraceptive pill. Does it make a difference? Do I have to come off it for me to start the donation process?
No, and in fact that's perfect, because very often we actually ask our donors to go on to the combined pill briefly in order to start off a treatment cycle, because what we're trying to do is to synchronise your cycle with the recipient cycle, and that's a perfect way to do it. So no, we say to donors definitely stay on the combined pill if you're on it.
So what if it was, what if I had a coil or something? Would that make a difference?
Depends a little bit what sort of coil it is. If you have just an ordinary copper coil, then that can stay in. It doesn't have any effect on the treatment cycle at all. For people who've got one of the sort of newer Mirena coils, or it's also called an IUS, then we do ask that that's removed briefly during the donation cycle.
What are the long-term risks if I go through the cycle? Is there any major side effects to the medication that I'm going to be put through?
No, not really. The thing people often worry about, and understandably so, is that they might be at increased risk of cancer. There's been good studies looking at risks associated with things like breast cancer, ovarian cancer, endometrial cancer, and to date there's no evidence to suggest that any of those are increased by going through ovarian stimulation egg collection. In general, we've got a pretty good idea about who's at risk of hyperstimulation, and the biggest risk factor is a group of people who have polycystic ovaries, where they've got lots and lots of eggs in the ovaries, lots of little follicles, and that's something we know from the word go. It's also slightly more common in ladies who are very slim and ladies who are under 30. And so for people where we know that they are at increased risk, what we would do is to start on a lower dose of drugs and to monitor much more often during the injection phase with scans and blood tests, so that then we can adjust your dose so that hopefully you don't run into any problems.
Are the injections that we have to do they hurt? Where do they have to go?
Generally not, they're just under the skin. Most people do them either into their thigh or into their tummy.
I can get side effects from sort of overstimulating. What does this mean, and what things can I do to stop that? Or is there anything I can do to stop it?
Okay, so ovarian hyperstimulation is probably the most serious risk for being a donor, but the good news is that it's rare. So in general, we would say that up to 5% of people might have very mild symptoms of hyperstimulation, and I'll go on to tell you what those are, but probably less than 1% of people would actually have really severe hyperstimulation. Obviously, when you take the drugs to stimulate your ovaries, they will become much bigger than normal. But if you're someone who produces a lot of eggs, typically more than 20 eggs, then as well as having big ovaries, they can also release fluid into the pelvis. And the main things that people describe are feeling very bloated, feeling as if they've got quite a lot of discomfort in their tummy, and sometimes people feel sick. And the most important thing you can do is just drink lots and lots. And for most people, that's all you need to do.
Are there any medical reasons why I wouldn't be able to donate?
When we first see you, we always ask you about family history, and sometimes things come up, genetic conditions which run in families, where we might advise that perhaps we wouldn't want to accept you as a donor. Sometimes just in the course of screening, we find unexpected things. For example, so occasionally we find that donors might carry a gene for cystic fibrosis, for example, which they didn't know about previously. And when that's the case, we'd obviously tell you and give you advice about implications for having your own family in the future. But just because we perhaps might not accept you to be an egg donor doesn't mean that you can't have your own children.